pleasure to introduce you to Amber Kaylor, who is one of the newer executives of the Ronald McDonald Children's Home of Central Illinois. She has worked for the non-for-profit industry for nearly 20 years, rising to the challenge of providing strategic vision during times of transition and growth. Amber is passionate about identifying and leaning into potential that exists through transition and adaptation. As the CEO of the Ronald McDonald House of Central Illinois, Amber has successfully implemented a growth strategy, achieving revenue growth of 65% while reducing costs by 15%. As Ronald McDonald House Charities of Central Illinois capacity grew by 40%, Amber successfully scaled staffing and operational resources, created cohesive operating policies and procedures for the two Ronald McDonald House programs, all while fostering staff growth and development. Outside of the office, she enjoys fitness classes, boating, and spending time with her husband, Brian, son, Maddox, and many other family members and friends. She is also a fellow Rotarian in the Decatur area, and so she covers a lot of territory, and we're happy to have her represent the Ronald McDonald House in Peoria, Illinois. I'm sure you guys passed it when you go see the highway, so excited to have you here with us today, Amber.
Good afternoon, everybody. All right, now 2 people have told me they're leaving while I talk, so everybody else, you're stuck. Just throwing that out there. I want to take a moment really quickly after my very lengthy introduction, sorry about that, to recognize our Chief Operating Officer. Many of you may know Dr. Eileen Setti, who is here with me today. She keeps me on track, so, make sure that it is indeed. It is indeed. I'm going to talk a little bit about Ronald McDonald House. Some of you are probably already familiar with us because this community has rallied around us like nothing I've ever seen before. The house opened in December of 2019, as many of you know. And as Ashley mentioned, I cover a lot of ground. We have 29 counties in our service area. I've never seen anything like what I see here. So it's really interesting when I'm in Peoria, as opposed to Springfield or some of our other communities. People will just come up to me and say, "Oh yeah, I helped scout the location for the house," or "I helped do this when the house was being built," and everybody kind of had a piece of it. So many of you are probably in the room that had a piece of it as well. So thank you if you did. I'll get to tell you about all the amazing things that have happened thanks to your help. So our mission is very simple. We provide a supportive place for families to stay while their child is receiving medical care. And we also promote programs that directly improve the health and well-being of children. Breaking it down, it's just if your child is ill or injured and they are inpatient or outpatient receiving medical care anywhere in the area, the family needs to be supported. It's truly part of the healing journey for the family to be supported as well, and that's what we do. We make sure that the family is receiving the care they need so that they can focus on their child receiving the care that they need. We help the entire family to heal. We are part of a global organization, so this is something I always like to touch on. Many people will hear RMHC or Ronald McDonald House Charities referenced globally. We are in we're in 60-some countries. We have 378 houses across those 62 countries last time I had checked. And we help families save roughly $2 million a day in lodging, food, all of those kind of costs. That's as a global system, just for your reference. But it truly is something that no matter what part of the world you live in, if your child's ill, you need to be supported. So the growth of RMHC has been tremendous. We are 50 years old this year as a system, as a charity. So to be that global and have programs in that many places over 50 years is tremendous, and I think it just speaks to the need that exists. These are 2 houses. You've seen one of them, I'm sure. We're hard to miss. And this is our house in Springfield on the left that you will see. We were opened in 1986 in Springfield. That was our first location, and then grew into this community, as I mentioned, in 2019, and it's just been amazing. All those stats that I need to take out of my bio, all of those stats are really speaking to the growth that has happened since we opened the second house. Going from a small 14-room house, which I'll talk about, to having 2 houses in 2 communities over an hour apart, the house here being 22 rooms, that's a big feat for an organization. And it takes a lot of work from an entire team to really scale your operations and figure out how do we support all these families that we have now, and how do we engage the communities that they're coming from, because they're not living in Springfield and Peoria when they come to us. They're living somewhere else and coming to Springfield and Peoria for treatment. So it's really been kind of an interesting endeavor for us as a team to figure out how do we support this much larger, much more sophisticated organization that we have now that we're here in Peoria as well. So a little bit of stats about the two houses. Our house in Springfield, as I mentioned, is 14 rooms. Here we're 22 rooms. Our fourth floor, for anyone who's ever been in the building or seen the building, it's very tall. Our fourth floor is not finished, but it is shelled out for another 11 rooms. So eventually our plan and our anticipation is that we will grow to 33 rooms here in Peoria. That speaks to the tremendous medical community that exists here and all of the things that are happening. The need will be there because people are coming here for treatment. They're choosing to come to Peoria when they have that choice. And more hospitals are sending folks to Peoria for treatment when their kiddos need to be seen. Average length of stays, I'll talk about that a little bit. 16, 13 days, that varies. It's always very misleading because we have people that come, especially here, for specialty services. They may be coming for a treatment, a surgery. They may only be with us a few nights, 2-3 nights while they're recovering. We also have families who have lived in our houses for 9 months. So, you get both ends of that spectrum, especially if you're talking about a premature baby. Oftentimes, depending on how early that baby is, baby's not leaving the hospital until the due date or until they reach certain milestones. So we have micro preemies, oftentimes, which are babies that are born at like 23 weeks, somewhere around there. Those families are going to live with us for months, months and months on end. So the average length of stay is always a little deceiving because you get both ends of that spectrum. As you can see, in Springfield, the majority of our families are there for premature births, for NICU stays. Here we get a little bit more of everything. So NICU, we have a lot of oncology families. So the St. Jude affiliate that's here, the oncology center that's here, and then just those specialists, those specialty treatments that people are choosing to come to Peoria for. So we have a much different demographic, which has also been a learning curve for us. And it's been really interesting to kind of learn what do those families need, because as Jason and I were talking about earlier, the kiddos are in the house, they're not inpatient. If they're coming for cancer treatment, a lot of times they're going for their treatment and then they're coming back home. And by home, I mean us, the Ronald McDonald house. So how do we make sure that those families truly feel that they are at home, and those kids feel that they're at home and they're supported? We always say it's not our house, it's theirs, and we're just the caretakers of that house. So it's been an interesting endeavor to kind of learn all those different populations and how do we serve them better. These are our impact numbers from last year. This is also one of our kiddos. 435 families. Actually, these numbers are not updated, I don't think. We served 460 some. Yeah, and then 8,302 nights, if we're counting. So we like to track the number of families that we've served, but we also like to track the number of individual nights that those families have stayed with us, because that helps us to calculate how much we've saved families. If I'm doing rough math in my head, which is always very dangerous, but I've done it before, we saved families over $1 million last year in those 8,302 nights that they were able to stay with us. That's money they didn't have to spend on hotels, they didn't have to spend it on food, they didn't have to spend on transportation to and from the hospital, Wi-Fi, all of those kind of add-on things you think about when you stay in a hotel that add up very quickly. So the impact of that number is really dollars that families did not have to spend and stress that they did not have to, take on themselves when they're already stressed about the health and well-being of their child. So again, if you were part of the Peoria House, thank you, because this is demonstrating the impact that it has each and every year and has had since we opened. Talked a little bit about the things that we provide. Every room, if you've never been in one of our houses, just so you know, some people are kind of confused about what it is. We're basically like a hotel. We say we're hospitality house. Everyone has their own room, their own bathroom. The Peoria House is all mini suites, so they have a living area as well. So it looks like a little apartment, essentially. We can house 2 to 4 people is usually what we say, but trust me when I say we have fit much more in those rooms. Sometimes families come with grandma, grandpa, other siblings, whatever the case may be, we'll make it work. We will make it work. So They get laundry services provided to them. We will wash their bedding, their towels, all those things, but then there's actual laundry facilities on each floor in the house here in Peoria, because just like home, you gotta wash your clothes, you know. We have meals provided. If any of you in this room have come and served a meal, thank you. That is a huge part of taking care of families. It is hard to think about what you're gonna eat at the end of the night when you don't have an ill child. When you're coming from the hospital home, the last thing you should have to worry about is what you're gonna eat that night. So our goal is really to have a fresh home-cooked meal provided to our families each night. If a volunteer group is not there, our staff cooks. So we make sure that they're always taken care of. We package it up and we put it in the fridge. So if you don't get home from the hospital till 11 o'clock at night, just heat it up. It's there for you, it's ready. We also have snacks and all sorts of, way too much food. I eat a lot. There's an abundance of food in our houses. But we want that because if you're gonna go spend the entire day in the hospital, you're probably gonna wanna load up on snacks and take things with you so you don't have to hit the vending machine, you know, repeatedly. That's just another way that we're helping to save money for these families and stress, you know, like, hey, I got it taken care of and I don't have to worry about it. Some families will buy food on their own. You got a favorite coffee creamer or something like that that you want, but realistically, you don't need to purchase anything, you know, in our houses. It's all there provided for you. And the comfort and the support are the important part. All these other things are part of how we take care of families, but I always say, like, you could afford to go to a hotel. A lot of our families have the means to go stay in a hotel if they need to. What you don't get at a hotel is support. You're gonna be isolated in a room and no one around there knows what's going on with you. You know, you're coming and you're going, maybe you talk to somebody in the lobby, but that's it. With us, our staff knows exactly who your child is, what their diagnosis is, and what they have going on from day to day, because we communicate back and forth with the hospital. Is today a treatment day? They know about it. Is today gonna be a rough day? They know about it. Did today not go the way that they hoped it would go? They know before the family even gets back. So that is how we provide support, and that is how we really wrap around these families to make sure that they're not walking through this alone, because their support system may be 2 hours away. You know, their support system is wherever they're from, and they may not all be able to be there with them. The other thing is they're surrounded by other parents and other families and caregivers who are going through similar things, so they have somebody else to talk to. You know, did you find out you were gonna get a G-tube today as well? How do you feel? You know, those conversations can happen. Those conversations can't happen when you're in a hotel room and it's just you and your spouse, or sometimes just you. You know, maybe the one spouse has to be working and, you know, you got mom or dad staying in the house, but they don't have the other caregiver with them at all times. So I always tell people, I don't care if you can afford to stay in a hotel. That's not where you need to be. You need to be with us. You need to let us help you. You need to let us support you, because that's the magic that happens inside our houses. People always want to know, how do we do it? Because nobody pays for anything. We never ask somebody to pay. We never ask for a donation. We are 100% privately funded, and this is how. We ask for individual donations. We ask for corporate donations. We have events, which I'll tell you about. The important thing for me to tell everybody is McDonald's does not fund us. That is the common misconception. I thought that when I got the job. My job would be much easier if McDonald's funded us. And what that relationship looks like is McDonald's, the company, so big McDonald's, does not fund us. We don't get checks from them, anything like that. Our relationship is with our local owner-operators. So your Terry Clark's, your Mary and Paul Bresnays, Nathan Pappas, who has bought the stores here in the area as well. They allow us to come into their stores and do fundraising in their stores. So if any of you in the last 2 months bought a Give a Little Love heart, thank you. That's a fundraiser they do for us. If they ask you to round up, please do. That money all comes to us to support families. If you put money in those little change things, they all look horrible. I know, we're working on it. But all that money comes to us as well. So that's the local owner operators giving us access to all of you or their customers. If you buy a Happy Meal, for anyone in here who has small kids or grandkids, we get 1 penny of every Happy Meal that they allow us to have. I have an 8-year-old son. It makes me feel much better about my dietary choices for him. So those are all things. Shamrock Shakes, which I know just ended, they allow us 25 cents of every Shamrock Shake as well. But that's something that the local owner operators do because they truly believe in us and we are part of their culture. So that's something that's really like ingrained in them as an owner-operator. But that's the McDonald's relationship. So for any of you that know Terry, here is Terry and his lovely daughter Natalie at one of their stores. They were our Roundup champs last year. So again, if somebody asked you to round up and you said yes, thank you, we track all those numbers, and then we go in and we make a big deal about the crews. Those crews put up with a lot. They have a rough job some days, and they're, so us asking them to ask one more thing can sometimes be a lot for them, to ask one more question when they're trying to make it through a lunch rush. So them doing things like this, we really want to make sure they feel the love, pun intended, that they know the impact they're having on our families. So we send them family stories and all those kind of things so that they understand what they're doing. Special events is about 20% of our support, and that's things like Wine, Women, and Shoes. If any of you attended our inaugural Wine, Women, and Shoes event last year, it's coming back October 10th, and it was fantastic. It's an event opportunity for us to raise funds and spread awareness. We invite a family, they tell us about their story, and it's just a really fun evening. We also have a golf outing in September here that our McDonald's owner-operators are very involved in and help us put on. Terry's office helps us put that on. So that's another way that we raise money. And then just individual and corporate is the bulk of how we get it. So people that are giving individual donations, recurring donations, corporate partners that partner with us, that is truly how we get our money. And, that is how we support families. That's why they don't ever have to pay. We never ask them for a donation. It's because of the generosity of all of these different funding sources that allow us to do what we do. Now I get to talk about our families. I try to fly through all of the boring stuff, which is not boring to me, but I know it can be a little dry, to get to the good stuff, which is the families. These are actual families. Every picture in this presentation are actual families that we serve here in Peoria. And we had a very weird spell of multiples. We had several triplets in the house at the same time, several twins in the house at the same time. And it seems like it goes in cycles where they'll all show up at once. I don't know what's happening with the water or the air during that, that particular time. But these were some of our multiples that were in the house during what we called our month of multiples. And, I'm gonna go back. The slide that I had a few back, and I'm gonna go back to it just because I want to tell you a quick family. There we go. I got clicker happy. That is Jackson. So if you were at our Wine, Women, and Shoes event, you got to meet Jackson because Jackson and his family came and told their story. So Jackson is the perfect example of why we're here. When Jackson was born, he was born with a heart condition, and he had to have surgery at 15 days old, multiple surgeries, lots of things happening. At that point in time, Ronald McDonald House did not exist here in town. And I know Family House has been here for years and years, of great partners of us, but I don't think they were able to access Family House at that particular time. They incurred quite a bit of credit card debt staying in a hotel. They were in a hotel for about a month. So they stayed in a hotel. Dad had to continue to go back and forth to work. So mom spent a lot of time at bedside and or by herself when dad had to be away. That was a traumatic experience, but Jackson got better. He got better. He made it through the surgeries. He's a strong kid. Unfortunately, about 7 years later, what they thought was a cough turned into a leukemia diagnosis. So that is devastating on its own. But they had all this additional trauma from his birth and what they went through, and they thought about, what are we going to do? We had all of these other factors, and they went to an appointment and somebody told them about us. And so Jackson is one of our kids, and his family is at home with us. We've been involved with Jackson's family for about a year now. He's going through treatment. Keep him in your thoughts, your prayers. He's still fighting. He is an extremely strong little boy. But that's why we're here. And that's what we do. And there's no better way to demonstrate the importance of this house and this community and just the way that you all love on our families and our mission than Jackson, because it's a perfect example of how we serve people and how we impact families. So for all of you that were part of that continue to be part of it, thank you. And I'm open to questions.
Thank you for being here and telling us a little bit about this. Can anyone use your services? Is there an income threshold?
No income threshold. We actually don't ask any income questions. We have an intake process that's all done online, so the family can fill it out while they're in the hospital, while they're being transported. We do run a background check on everyone who stays in the house because we want to make sure it's a safe environment. But no, I always say the child illness is the great equalizer. So, and we were actually started by a Philadelphia Eagles player. That's how RMHC started. And he and his wife, their young daughter was diagnosed with leukemia. They slept on the floor in the hotel. And so they got to see firsthand what that experience was like. So I always say somebody with money started.
Yeah.
You know, in 1974, football players did not make what they make now. I think we all know that. But it really isn't about means. It really is truly the need is that your child's ill. So we we purposely don't ask that question. Yeah, but that's a great question. Thank you.
And kind of part of that question is, how do families find out about you? How do they get referred to Ronald McDonald House?
We work really closely with the hospital. So OSF, Children's Hospital of Illinois, is our hospital partner. We just had their case managers in the house not too long ago. We work with the social workers, the nurses, and they tell the families about us. We also go to all of our feeder hospitals. So if a family is going to come from Bloomington or you know, somewhere else, our hope is that they're going to get that message there so that during transport or when they're planning a procedure, they can get on and fill out the application ahead of time. But we really rely heavily on our hospital partners to be the voice of that. And we go into the hospitals quite a bit and foster that relationship.
If McDonald's does not fund it, how did it become the Ronald McDonald?
That's a great question. Yeah. So Fred Hill was the NFL player, played for the Eagles. I'm an Eagles fan, by the way, just for one of many reasons now. He went to his GM and said, hey, we need to do something for families. So the Eagles approached the local McDonald's owner-operator there. And that guy kind of got, I can't remember his name off the top of my head now, he kind of got the conversation rolling. And McDonald's, we call them our forever and founding mission partner because they agreed to let the charity use their name. So nobody else gets to use their name but us, which is amazing. So that's where the McDonald's partnership came in and the local owner-operator partnership came in. Yeah, so we have to respect all their branding and all that kind of stuff, you know, but really that's what started. It was just individual conversations, and Coca-Cola is a huge partner of ours as well for that same reason. The local Coke person kind of entered the conversation, so all of our product comes through Coke and things like that. Great question, thank you.
I was so excited to hear you today. This was my previous life in Chicago. I worked for Ronald McDonald House Charities for Chicago and Northwest Indiana. Thought your presentation was wonderful.
Thank you.
The thing I was going to ask about is, well, first of all, thank you. This is a 365, 24/7 operation, and I don't think everybody realizes families check in at midnight, 1 in the morning. So could you share a little bit about how you cover the holidays and what a family experiences when they check in, and then how we can help as volunteers with maybe siblings that are staying in the house or over holiday support, or is it meals? Just ways to get involved in addition to giving money towards the house.
That is a great question. Thank you. So yes, 24/7, 365. We staff 24/7, 365. But we are also currently building our volunteer army, is what we keep saying. All volunteer, services stopped during COVID. And we had just kind of started with the momentum here. So we have been operating solely on paid staff for really the last, better part of 5 years. So now I say that in terms of operations, not meals. We've had meal groups coming back in and doing things with us, which is fantastic. So we're really looking for program volunteers, those folks that'll come in, sit at the front desk, answer the phones if they need to, help with the door. The meal is a huge piece. Meal groups are always something that we need. But even just someone coming in that's willing to do laundry is a huge help. Those are the things that our staff tries to manage. I always say it's like, imagine all the things you do at your house times 22 rooms and sometimes upwards of 50 people. And that can mean when we have a lot more kiddos in the house, as you know, it's crazy, because kids are running around and they need things and families need things. So any extra hands when it comes to program operations is a huge, huge help for us. We have that volunteer application on our website, which is rmhc-centralillinois.org. You can find it there. You can always just call us too, and I've got cards and Eileen has cards that we can give you. But for holidays, Our staff works the holidays as well, usually volunteers. That's a much harder ask in terms of program volunteers. We always have groups that want to come in and cook a meal, but I always say all the holidays happen at the house. Santa comes to the house, the Easter Bunny comes to the house, all of those things. So one of the things that Jackson's family talks about in their story is when they were in the hospital, our staff called them and said, "Do you want to come shop for Christmas?" And they were like, "What are you talking about?" And he said, "We set up a Christmas store and our families can shop, and then our staff and volunteers will wrap it, and then it goes to the door, on Christmas morning." Same thing with like Easter baskets and stuff like that. And every holiday that, any holiday that our families are celebrating. So those are great ways for volunteers to help out, when it comes to holidays, because nobody wants to be at the hospital during a holiday. So how can we make it even more special? Yeah. Thank you very much. That's a great question.
On a can of soda, there's the little tab that you clip.
Yep.
And it opens up the soda, and you can bend that off and collect them. And I've collected them. And is it still true if you take those tabs to Ronald McDonald House, somehow it raises funds? How's that work?
Yep.
Tell us about that.
Yep. Our thank you for that. Our Pop Tab program is a legacy program. We've done it forever. We take the little Pop Tabs and we recycle them. And we get a decent amount of money each year from our Pop Tab program. So I can't think of last year what we did, but it's a line item on our budget, honestly, because so many people collect them. So everywhere I go, people hand me Ziploc bags of Pop Tabs. So it's very much a thing. My neighbors leave them in my mailbox. So yeah, and we have little houses we can give you if you want to collect them, but that's definitely something we still do and we still accept those. So thank you for doing that.
So during COVID, my company, this is my company, we received several calls from individuals who wanted to purchase a meal and have us deliver it to the house. And we did that several times during COVID. Is that still done?
Absolutely, yeah. If you're somebody who doesn't like to cook or doesn't have the ability to go into the house and cook, or if you're like me and nobody's wants you to cook, you can absolutely cater a meal, and a lot of people do that. So thank you for delivering, because delivery is always probably the biggest hurdle for us. People say, "Oh, I'll give you a gift card," and that's great, but when you're short-staffed, you don't always have the person to go pick up the meal. So delivery is fantastic, and we appreciate that. But absolutely, you can pay to have a meal catered.
So Ronald McDonald House had a lot of local support when you guys opened. Epic was lucky enough to partner with them to do the artwork on one wing and do all the dinnerware. So if someone eats in the kitchen on a plate, a bowl, a cup, Epic made it. But can you talk a little bit about the capacity and how you're at? Because I assume that that's a struggle as well with turnover and everything.
Yeah, absolutely. So in terms of family room capacity right now, are we at 100%? Okay, so we have 19 families, one room is out of service, so we're almost full at 21 rooms. A couple that are on our wait list, which is like, they know they're coming to us. Back to the volunteer question and to speak to your capacity question, one of the biggest struggles we have right now, because nobody has enough staff, let's be honest, nobody anywhere has enough staff, is when a family checks out and we have another family waiting, you got to flip the room is what we call it, just like at a hotel. So our staff is going up and flipping the room, but then meanwhile, if you've got a family down in the kitchen or the common area who needs something, trying to balance that, so capacity is a huge thing that we track, because not only, do we want to make sure that we're getting everybody in that we can, but we got to look at when are they leaving, when is somebody else coming, and then how are we going to flip that room so we can get the next person in. So that's another great volunteer opportunity as well. Housekeeping isn't, sexy, so to speak, but those are the kind of things that we really struggle with, as a staff. And a lot of times, Eileen is, helping flip a room or watching the front desk, or our CFO has changed plumbing before. I don't know if that's wise, but it still seems to be okay. But you do what you got to do. If a room needs to get flipped, our entire development team was flipping rooms one day because we didn't have anybody else to do it. So it's a good problem to have, because it means we're getting more families in and we're helping people and we're serving them. But that's a great volunteer opportunity. And we've had some Epic folks in that worked with us, for extended period of time, helping to flip rooms and do those kind of things, that just to be an extra set of hands. So thank you for that partnership. Anyone else? All right, thank you all very much.